Hello, this is Tony Heller from RealClimateScience.com. It's been 25 years since China introduced the Type A Wuhan flu, a virus which was deadly to the elderly. And then 2 years ago, somebody enjoyed a tasty-looking bat in Wuhan. The next thing we knew, people wearing masks were lying dead in the street in Wuhan, and everyone else was running around with hazmat suits. The Chinese government introduced the idea of locking people in their homes, an idea which Western leaders found brilliant and irresistible. One government official after another in the free and open democratic West jumped on the idea of a government-mandated lockdown. Our always accurate press corps in the United States started telling us that 21 million people had died from COVID-19 in China. So many Americans started begging to be locked down and having government force them to cover their faces when they went outside. Here's the official COVID-19 data for China. China reported a few thousand cases during January and February of last year, and then they were pretty much done. Many people have questioned the accuracy of the Chinese statistics, just as many people have questioned the accuracy of the United States statistics. Most governments lie about almost everything important. Now let's go back to March of last year. At the beginning of March 2020, I spent a couple of weeks in Costa Rica studying the climate crisis. And then I returned home to Colorado to face an even worse global warming disaster. The heat in Colorado was unbearable, so I took Toto and Rambo down to Arizona to escape. Arizona was very beautiful, but all was not well, as you can see by the concerned look on Toto's face. By March 17th of last year, the Wuhan flu was dominating the newsstands. We ate at this restaurant in Glendale just a few hours before they shut all the restaurants down. People in Flagstaff, Arizona were behaving very rationally, stealing all the toilet paper from the gas station. I overheard a couple of Northern Arizona University co-eds talking about the pandemic. One of them said they won't shut down the internet or social media because they need to keep us scared. That was probably the most accurate commentary I've heard during the past 2 years. Meanwhile, the Mount Sinai Hospital in New York City put out this request. March 25, 2020, COVID plasma needed. Patients recently recovered from COVID-19 have high levels of immunity in the form of antibodies in their blood that can be transfused into very sick COVID-19 patients in our hospitals. This treatment is known as human convalescent plasma and has been used in previous pandemics. We are ready to start treating patients later this week, but need your help. If you have recently recovered from COVID-19, please volunteer to have your blood tested to see if you have high levels of antibodies. The hospital reported on March 24, 2020, the process of using antibody-rich plasma from COVID-19 patients to help others was used successfully in China. According to a state-owned organization which reported that some patients improved within 24 hours with reduced inflammation and viral loads and better oxygen levels in the blood. The use of human convalescent plasma was all over the internet at the end of March last year. As Mount Sinai Hospital said, it was well understood that patients recently recovered from COVID-19 have high levels of immunity in the form of antibodies in their blood. In June of 2020, the World Health Organization defined herd immunity this way. Herd immunity is the indirect protection from an infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. But sometime between June and November, the World Health Organization changed their definition of herd immunity. By November 13, 2020, natural immunity had disappeared, and the only way a population could obtain herd immunity was through vaccination. That was quite a change from a few months earlier when hospitals were using human convalescent plasma to save lives. And there was a little bit of a twist to this plot. The American Red Cross had this document up on their website. If you receive any type of COVID-19 vaccine, you are not eligible to donate convalescent plasma with the Red Cross. That was a very interesting policy by the Red Cross, and they later took that document down. I quoted the document word for word on Twitter, and then the American Red Cross denied that they ever said it. They also said that they had discontinued their convalescent plasma program. Now let's go back and look at the November 2020 definition of herd immunity from the World Health Organization. They said herd immunity is achieved when a threshold of vaccination has been reached among the population. Let's see how that theory is working out. Vermont is the most vaccinated state, and cases are skyrocketing and currently at record highs. That's Vermont up there, a beautiful state where I used to live. Now let's look at the four least vaccinated states: Wyoming, where I currently live, Louisiana, Mississippi, and Alabama. Cases peaked in Wyoming several months ago and have been dropping off sharply. And the COVID spike has completely disappeared in the other three least vaccinated states: Louisiana, Mississippi, and Alabama. I live just across the border from Colorado, which is the most vaccinated state between the coasts. Colorado has seen a huge spike in cases and their hospitals are in trouble. I have a friend in Fort Collins, Colorado who needs knee surgery and can't walk, and he can't get his surgery because they're only allowing COVID patients in. This is Wyoming, which has the lowest vaccination rate in the country, and this is Colorado, which has one of the highest. According to the World Health Organization definition, Colorado should have reached herd immunity. The latest official statistics from the United Kingdom show that vaccinated adults are much more likely to get infected than those who aren't vaccinated. Fully vaccinated adults between the ages of 40 and 69 are more than twice as likely to get infected as those who are unvaccinated. A large study out of Israel, published in Science magazine, reported the natural immune protection that develops after a COVID-19 infection offers considerably more of a shield against the Delta variant of the pandemic coronavirus than 2 doses of the Pfizer vaccine. Sweden understood natural immunity all along. They never locked down, they never closed their borders, and they never closed their restaurants and bars. Most of Sweden's children stayed in school, with Greta, of course, being a notable exception. Sweden's decision to not implement Chinese-inspired tyranny quite predictably made the New York Times very angry. On May 4, 2020, they showed a picture of young people enjoying themselves in a park in Sweden, and the New York Times said that the United States should not copy Sweden's behavior of allowing people to live their lives. Now let's look at how Sweden fared compared to some other countries like the United States. Under the expert direction of Dr. Fauci, the United States achieved more than 3 times the excess death rate of Sweden. And the excess death rate in the United Kingdom and Italy also was more than double that of Sweden, the most maligned country in the world last year. Sweden did what countries have pretty much always done during pandemics, and the New York Times described that as an experiment. In 2020, normal behavior became an experiment, and locking people in their homes became the normal. China showed us early on that masks are very effective at blocking the virus. And to be fair, there's no way for pharmaceutical companies to make money off of natural immunity or human convalescent plasma. Sometimes Toto thinks that humans aren't very smart. You can visit him, Kyrie, and Caesar on the web at realclimatescience.com.